in Sorba with Gravity Church and also Uptown Thrift. Well, my friend Dan just stole all my thunder with everything he talked about. But I do want to say that, you know, Karen mentioned it too, and Dan just mentioned it, detox facility. That's the biggest hurdle. I see it every day. I mean, I've been in the streets here in Lodi for about 3 years doing ministry, so I say the streets. I actually came from the streets. I'm not sure how many other people in this room have ever actually lived on the streets to know what it feels like, even if you start out living on the streets, in a sober state of mind. It doesn't last very long. And so then you create and start an addiction. One of the biggest issues with detoxing is the fear of detoxing. Any alcoholic or any drug addict deals with the inner battles of having to know that it's going to hurt. And so it's a fear. And that will keep them away from trying to detox on their own, on the street. So then you have a medical issue, you know, where they need medical detox. And some people, if you've been drinking long enough, some people know that it just quitting cold turkey could kill you. So those are a big issue. How do we change that? I don't know. I don't know how we go about that. There are some. The closest one I know of is in the Bay Area, and they have a list of about 50 people long all the time that are past the amount of beds they have. That's called Cherry Hill in Oakland. What we do is feed the people with the thrift store, and the Gravity Church is not really, you know, without all there's a total of 10 different churches or organizations that did what we call Church in the Park on Tuesday nights last summer. So it's not, you know, I think Gary was saying Gravity Church, you know, Church in the Park, that's not really just Gravity Church, it's a lot of the people in here coming together as one body, being able to do that thing. So we just kind of facilitate it. The biggest thing that I've seen over the past 3 years is relationships. There's a couple guys in this room that would tell you, no matter where they're at in their addiction, if I asked them to do something, change their life, they would, because they trust me. The relationship that was created and formed from sitting next to him on a bench in a park, that's bigger than feeding them, I believe. That's bigger than feeding them and putting clothes on their back, is creating a relationship with them, getting to hear their story, love them for who they are, know them for who they are, and yet they can know me for who I am. And they trust me. Then I can put any organization or any program right in front of them, and they'll say, I trust you, I'll do that, I'll try it. The success rate is not huge, but with combined efforts with a lot of people in here, we have seen literally in the past just even year, we've seen lives saved and changed. It might be one a month or one every 2 months, maybe one every 6 months, but they're being changed and they're being saved. We work with a few different organizations. One's in Nevada called New Hope Ranch. It's a Christ-based sober living house for men. There's another one for men out in Burson that we deal with. There's one in North Stockton that we work with. We ourselves at Gravity Church, we've actually started one up, and my friend Jason might be able to tell you a little more about this, but Second Step is something that we started at the church. We have guys that are willing to work, that are staying in the program. Again, it's a Christ-based program that requires them to do specific things to stay clean and sober, keep plugged in with not just our church, but with other churches and other things that other churches are doing and other organizations in town, in the community. And really what we're in need of there is housing. We talked about that before, housing. I had a conversation with Jason earlier, and he said, hey, talk about, you know, we'll even insure it. If there's a building in town that we can get our hands on, apartment complex or something, or we can be able to house more people and put them through what we believe is a good program, we'll accept liability. We'll take on the insurance. We'll do all the work that needs to be done. Because we believe that in that program, again, it will save lives and change lives. That's all I have.
Thank you.
Thank you.
Hello, my name's Amy Moreno, and I go to Gravity Church. I was actually working at Uptown Thrift when Vince Yorga came to me and asked me to keep one of the homeless men's dogs while he went to jail for about a year. My landlord, Gary, I did this. When he came out of jail, he went to the Burson house, and I didn't tell my landlord right away, but from there he went to Salvation Army, was going to earn a chip, I guess, with AA, got turned in late to Salvation Army, so he couldn't go there that night. So this homeless man comes to me and says, I need my dog, I'm going back to the bridge. And this is someone who had been clean and sober through his jail time, Burson House, Salvation Army, he had been through all programs. And he ended up staying with us for 6 months with me and my children, and his dog and my dogs, in a little tiny 2-bedroom house in an alley on the east side. And this man now has his own home. His girlfriend, who was also homeless, they were homeless, I think, 11 years. She ended up living with us for the last 2 months of the 6 month. They now have their own home and are loving God. And basically, when he was with us, he did what he needed to do through AA, and we did what we've been learning, me and my children, through Gravity and other churches, feeding in the park. Just put your hand out and give and offer what you have. And I don't have much to offer, I'll tell you that right now. But it made a difference in their life. And to see them now in the park when they come out on Tuesday nights, it's awesome to see how healthy they are. And it means the world to me. And I know a second step with Gravity, if we had the funding for a woman's home and a bigger men's home, it would be changing lives. And one way he did detox was going to jail. And if I know Jeff McCachran goes and ministers to people while they're in jail, and if we could do this to the handful that we think there's a possibility of them staying clean and wanting a new life. I mean, I know with Captain Gary, that's all he had to do was get his feet wet in it before he realized this is where I want to be, and took him out of the park. I mean, he's rebuilt relationships with his family he hadn't had in 15 years with his son, you know, and it was just plugging people into the right people and just everybody caring and pulling together that made a difference for them.
Amy, it seems to me that one of the big problems that we're facing in this situation is that of drugs and alcohol. And when you talk about detox, it implies that there's an alcohol or drug problem to begin with. And what do you do about that is the question, but the answer seems to be not only from you, Amy, but from the prior speaker and from just about everyone that's been in this room, that it's really a personal thing, that it's getting to know these people and developing relationships with these people and all that, and giving them a helping hand, and just listening to them.
Well, the gentleman from Salvation Army said you need to find out what it is that's bringing
But
them to their...
isn't that the answer? Isn't that the answer, or is that an oversimplification?
Getting to know them and loving on them. And getting to know someone and caring for them is two totally different things. I mean, if you put it all together with love from your heart and be genuine. I mean, I see people that are homeless that we feed in the park that, you know, come to my gate in the alley, you know, just, hey, Amy, what's going on, you know, and if I have a cigarette,
Is there a problem, do you think, with feeding the homeless people in the park?
Is there a problem with it?
Yeah.
It's not being done enough. Everybody from the community needs to come together and see what it's like to give. I mean, your heart will swell. I mean, and it comes back. These people have helped me when I've been at my lowest. I mean, when I'm standing at the register and I need $3 it could be a homeless person that gives me that $3. Or when I don't have money for gas. Believe it, the homeless have helped me. I mean, and it all works in a nice circle. I mean, it's a beautiful pattern when it's working.
Thank you.
Mhm.
Hello, Michael Nicolucci. I'm director of Third Heaven Ministries. I'm also a member of Bethel El Messianic Jewish Community. Listening to all these good folks here tonight, we're one of those fellowships that have been asked to participate in Gravity through Vince and Jason, Dan, getting to know these good folks. Kind of new, but not new to the streets, not new to homelessness. My wife and I, we kind of have a different approach. We actually take them into our house. Homelessness to me is a matter of comfort and fear. Most people are afraid. They're afraid to get out of their comfort. Many people have an extra bedroom, have an extra shower, and it sits empty. But the bed's got sheets on it, and it's got pillows. Bet you it even has a TV in the room with a cable box paid for, just in case someone shows up. That's reality. That's the fear factor. That's the separation point for most people, not all people. There's many things that have been talked about here. The resources here, there's no manual to this, and I really believe Mr.
Takeuchi.
Nicolucci Takeuchi. We must be family.
I think we are.
I think that if you take a look, faith-based organizations have a very high success rate to more so than civil or state or government-funded agencies. But both are needed because there's a resource base and there's a hope base. But they got to come together. What keeps them apart is fear, personal fear. Now, I'm not saying you got to just ask anybody to come into your home. We just had an experience. We had a gentleman come into our house. We invited in. My wife is the greatest adoption agency in the world, you know? But she has the heart of Christ, and I believe it's the same God as I have, so I listen to her as well, and I support her. We brought a gentleman in. We live over in Stockton. We have a nice home. We have extra bedrooms, and that's something we had to come out of, was our fear of dealing with other people that might be tattooed, may not have the same dress that we have, may have, maybe not even speak the same language. But at the end of the day, their heart's the same as ours. Because as Amy said, homeless people will help homeless people. They'll even help people that aren't homeless. Because people are people. These aren't mechanics. You know, so when we take a look at, how do we end the homeless? God says the poor will always be among you. Always. Not everybody's going to be at the same level. Some are going to have more, and some are going to have less. But God's word says, don't count yourself if you have more better than the one that has less, because you wouldn't have the experience of understanding the gift of giving if that person wasn't poor. And you who are poor, thank you for the gift, because you both have the same heart. It's a heart thing, homelessness, Mr. Takeuchi. It really is, and counsel. It's a matter of us getting outside ourselves, putting ourselves out there, not with an understanding. We had Gary back here, the mayor of Lawrence Park. The mayor. But he, you know what? He's there. You know why? Because at the end of the day, we are the sum total of every choice we make. We had a guy stay in our house for 3 weeks. We had a plan. We offered him and said, hey, our deal is to get you working, get you into your own place, get you into a relationship with your children, get you back where you're serving yourself and your family. In 3 weeks, he went back underneath the aqueduct on Lower Sac because he was overwhelmed. Some people, you got to want it. Some people want it, some people don't. The detoxing. I heard it. Dan said it great. It's a great statement. It just never left me. Because he has been here from the beginning. And he said, hey, there were 6, now there's 66, 86, 106. I'm getting compassion fatigue. Because our hearts are to see it go the other way. But people have to want to. drugs are easier to get than organic food and less expensive. I mean, it's so prevalent, it's so available. But we have the mechanics in place, we have the resources. I would hope, you know, when you say we don't know what we are, I hope that we would be at least a sounding board to the city's pocketbook that could help where the resources are needed in the right way. You know, in the right way. But we need to, as a community of people, discern that. We have a behavioral specialist here. We have heart specialists, faith specialists. We have all these specialists. We do. We just need to come together. Thank you.
Thank you.
Thank you, Mike.
Hi, I'm Cindy Harris. I've been a resident of Lodi for about 16 years. I'm currently president of the Lodi Democratic Club here in town. And I know I came in late. I was running to get here from Sacramento, so I'm sorry I missed the first part of the meeting, but I just have a few points I want to make. If they've been made before, give me the sign. One thing I've got to say, when I read the article, I was just sickened. I mean, when can it ever be wrong to feed a hungry person? I don't care where they are. That just hit home. How could you even question if giving a meal to someone who's hungry is the right thing to do? Of course it's
What is your name, ma'am?
Cindy Harris. I just wanted to point out a couple of other things. There's a gentleman in Tracy by the name of Marvin Rothschild who has done an incredible job with the homeless in Tracy. And not knowing exactly who to put him in contact with, he is a man, I was hoping he could come with me tonight. He couldn't make it, but he's been a tremendous force over there in helping Tracy with their homeless problem. He's spoken at great lengths on different things. I don't want to speak for him, but I'd like to know who I could connect with him.
Joseph.
Okay, great. That's great. He's an angel over there, and he's done some good things. And with similar demographics and all, I think we could learn from Marvin. The other point that I wanted to make, I'm not sure if people know that there will finally be a methadone clinic in Lodi as of December. This is something that this town has needed for years. I've personally gone through the OxyContin addiction problem here in Lodi, and it's ugly, and it has absorbed so many of our kids. I can't tell you how upsetting it is for me to go there and see these faces in town that I've known since they were this big. And there has not been help for them in Lodi. There's not been any place that they can go. Everything is in Stockton. And if they can't get there on their own, then they're going to stay here and keep buying and keep stealing and keep doing what they've got to do to live, because it's a hell of a thing to go through. I'm not condoning, at all. And I am so upset that in my own family, my son has fallen into that deep abyss. Now he's been sober for quite a while, and by the grace of a doctor named Ernie Vasti, he's gotten help. And it's Ernie Vasti from Stockton that will be opening the clinic here. And I think that that's something, I forget the exact address. I know he was looking at property around Lodi Memorial. So I believe that's where he's found a spot. But we need to connect to that too. That is going to have a great effect on the community. We have to get some of these homeless people who have no other choices there, find out the resources, whether it's Medi-Cal or what we can work on to get them there, so at least they can get clear-headed and find themselves again and find some direction. Because if they're addicted and they're on the streets now, so much of it's not just addiction, it's mental health issues also. And at least if they're going to a methadone clinic, they have a counselor to talk to who knows the resources and can direct these people to places that can help them. So I just wanted to throw that out. I don't know how many people are aware of it, but this is something that ties into this whole homeless situation, and it's a great thing for the community. I hope the young people will not be afraid to go, but will get over them being embarrassed and go. When I've gone to the clinic in the past and I see these kids that I know from here, they won't even look at me because they're embarrassed. They're not happy where they're at. They're sick kids. So that's my 2 cents worth, but I appreciate you listening.
Thank you for coming.
Thank you.
Unfortunately, I've heard my name mentioned way too many times already tonight. My name is Dennis Buettner. I'm from San Joaquin County Behavioral Health Services. I am a homeless outreach worker. We are funded by a federal grant, a PATH grant, and we serve the entire San Joaquin County. Unfortunately, there are only 2 people like me who go out into the county. And since July, unfortunately, well, not unfortunately, my coworker had a baby. Unfortunately, I've been working solo since then, so it's a little hard. A couple of things. First of all, we have to approach a homeless problem as a multi-dimensional problem. It's not a one-size-fits-all type of situation. What these people are doing is incredibly important. I cannot stress that highly enough. But it's not the whole thing, because the problem we run into is so much beyond what we can do here. I will say, on all honesty, if I realized you were serving Da Vinci, I would have been over there on Fridays, but I didn't realize that. It's real important that we understand that part of the problem is just flat out it is housing, because you know what, if you don't know where you're going to sleep at night, if you don't know you're going to be safe at night, you're not going to care about anything else. And in all honesty, and all the time that I've been doing it, I've only met one person who claimed, I'm just going to say claimed, that they actually got sober while they were still living on the streets. It just doesn't happen. And all flat out and honestly, it just doesn't happen. It's part of the problem. And even somebody who has SSI, and I'll use this for example, that has SSI, if you haven't paid attention, while housing prices have come down, and I've known people who've been able to get into housing, to actually purchase houses, people who have employment, rents is actually going up. Because there is a higher demand for rentals. And so actually what the problem is you may have somebody maybe getting $800 a month, and now all of a sudden what's demanded is $600 a month in rent. And not many people I know can live on $200. And that's an ongoing problem, and that's part of the situation and Joseph alluded to earlier, the committee, and it's comprised of many agencies and from the county and from cities that we all see as a problem. And different cities have taken different approaches. In all honesty, some cities have said, there's a city line, go. And some cities have said, okay, we're going to try to deal with this now. It was mentioned about Marvin, and I just gave Joseph the phone number to Marvin. I know Marvin very well, and they have done a wonderful, wonderful thing. But again, part of the problem is, part of the nice thing that happened is they got buy-in and they had help from real estate people who actually had access to housing. And they were able to rent for people but they had to have income. That's the key, is the income piece. Now, when I said it was multidimensional, one of the things you're getting just a wide variety of situations. You're having young kids that are being aged out of foster care. You're having people who have had some falling out with their family member and they end up on the street. Yeah, people, I'm going to tell you this, we're seeing an increase in the number of guys who went to work when they were 18 years old, they did the hard physical labor, and now they're 50 years old and they can't do it anymore. Try to be a roofer for 32 years. It takes a toll, and they can't compete with that next kid, that 20-year-old in that same job anymore. So that's a problem. Then you have obviously the mental health issues and your substance abuse issues, and obviously that is a key thing. And I want to say this, and real important for me to say this is, unfortunately, because of the substance abuse issues that we face a lot of times, it's very difficult to determine whether somebody actually has a mental health issue. Because you have to deal with the substance abuse issue, you can't figure out whether you're dealing with something that's underneath the substance abuse. Much like we said, why are they homeless? And I totally agree with you, we need to get to why are they homeless. Sometimes you can't even get to why they're using because you have to dig through the layers, and that takes a long time. I have to agree wholeheartedly with what I've heard as far as it's all about relationships. And I know that people talk about me, but Karen West is like the queen of Lodi for a lot of the homeless people. They absolutely adore her because they know that she's on their side. I mean, she is revered among many of the people. The work that they do at Salvation Army is just phenomenal. Is it enough? No, I mean, we need more. And I hate to say it, but even the downtown hotels we have leave something to be desired. I know people who would rather live on the street and to go into those hotels because sometimes they have bed bugs and other kinds of critters in them, and they have a huge drug problem over in that area, and they don't want to be around that area. If you're not familiar with it, Lawrence Park, you kind of have two separate people. You have the alcoholics, and I'm going to say this, the big problem lately has been heroin addicts. It has been an ongoing problem, and they don't mix. I'm going to tell you that right now, they don't mix at all. They don't want to be around each other necessarily. And that's been an ongoing problem. So when I say that, yeah, great, we need to come up with a solution, we have to come at it from so many different angles. There are so many different layers and so many different problems that come with it. It's not going to be easy.
But do we try to get more people involved like these people, or do we attack these individual problems that are the source of the problems? That is kind of what we're here to ponder.
I'll give you a simple answer.
I'm not sure what the answer is.
I'll give you a simple answer, yes, to everything. We need more people and we need other solutions. I want to say that part of the problem is and I would say Joseph mentioned, and I happen to be familiar with some of the things that he's already talked about. You have to do that. You have to do what Salvation Army do. You have to do what everybody's doing, because you know what? It may not be the first time when somebody says, hey, you're going to change your situation. It may not be the second time. It may be the 11th, the 13th, the 23rd, the 50th time before they finally go, you know what? I've heard that someplace before. I mean, if you know the definition of insanity in AA is doing the same thing over and over again, expecting different results. And some of these people, that's the whole thing. And you have to understand, they only do what they know to do sometimes. And I also want to, and I put this forth to you, is that you have to understand that homelessness in and of itself is a culture. And some people don't, they go, what do you mean it's a culture? This is what I mean by it, and I'll use an exact actual example. Then in Australia, they took some people and they actually created housing, and they would take people and get them into housing, and what would they do? They would invite their friends to come in with them. They'd end up getting evicted. Because their culture is on the street. These are the people that they hang with. These are people that, now the people that I do know who have broken loose of that, they've actually had to cut the ties. If you know most people that deal with substance, we almost have to break the ties with the certain people that are living that same life, and we can't be around it anymore. And at that point, we have to break off and say, I can't, whatever it is, whether it's alcohol, whether it's some drugs, whether it's some other type of thing that pulls you down and back into that abyss, you have to break that tie, and that's a hard thing. So I think everything is the answer, and I think that you have to have government buy-in. I think we have to understand it. And I know people, if not, obviously being a government employee, I understand budgets suck right now. That's just, they're bad. We don't have enough money, and we would love to do more. Joseph, I don't know if you mentioned it.
No one has enough money.
Yeah, Joseph is on the Emergency Food and Shelter Program Board, as as Ted is also. We're all on this board. We're always trying to get more. Well, what can we do to get the biggest bang for the buck? And I want to give you an example of how things have been cut. When I first got on the committee, the Emergency Food and Shelter Program Board, each shelter was getting $50,000 from this grant. Now that's 8 shelters. All 8 shelters now are splitting right around $50,000. If that doesn't give you an idea, and just to explain substance abuse, the San Joaquin County Behavioral Health also includes San Joaquin County Substance Abuse Services. Just a few years back, we had 21 programs. We currently have 3.
But is that the reason we have to just throw in the towel and just say, we're not going to do anything more?
No, I don't think we throw in the towel. We try to find, we have to try innovative
I think
types
so
of
too.
things.
I think we have
And
to
that's
do
what the thing is, when we do identify somebody that has a mental health issue, we might be able to do something different with that situation. But there's a lot of people out there who are using it. We don't know yet because you haven't gotten them sober or clean. I don't really like the word clean, but you haven't got them sober long enough for them to even remember what it's like to be sober.
But attacking, and I don't like to use that word either, but going after the mental health issue is different from going after substance abuse issues.
Absolutely.
And there are many reasons why people abuse substances. Drinking and drugs are just only two of the substances that I'm thinking about. But there are many reasons for that. And do you go after each of those reasons? And if so, aren't you dealing with all of society? In which case you're facing an unending problem.
You know what, and I will tell you this, it isn't going to be an unending problem. As long as these things are around us, it will be an unending problem. And the number one, I'll tell you that I believe is people can't cope with life. And so they use, and that's the regular thing. However, whatever issue it is you're dealing with in that situation, that's an ongoing problem, and it will always be a problem, but it doesn't mean we give up. You know what, I want to honor these people. When they say, I got one, I got two, I got three people, maybe that's, you know what, that they're individuals and they all matter.
Yes.
And you know what, people see me running around and saying, say, well, you know me, I'm trying to save the world one person at a time. That's all we can do sometimes, is work with that one person. If I get that one person to help and they start to see the light, you have to understand, the key here is they have to develop an insight that there is a problem. That there is a problem with how they're living, that there is a problem with, the fact that, and I don't know if you understand it, I'll give you a statistic that will scare you as far as mental health. The average mental health person lifespan is 20 years less than a typical person. They usually die in their 50s. And the problem is going to be made worse by the veterans that are coming out. And we know that flood is going to be coming. It came after Vietnam. It's going to come again. We happen to be working at San County Behavioral Health, also worked with the VA. We're working on other programs. It's a problem that's going to continue. And I think maybe if I want to share one thing with you is we have to build a system so we can deal with it versus just solving these people and then that's all that's going to be done. It's going to be a system. It's going to rotate in. There's always going to be a need for Salvation Army. There's always going to be a need for the people who have stepped forward and offered their homes and people who have taken them in and gotten them off the street, for the Marvins of the world, for the Josephs of the world, for all these people. There's always going to be a need. And in all honesty, that's why I love what I do, because I love helping these people. I don't see homeless people, I see people. And as long as we keep that attitude of, you know what, there's a person there and I'm going to help them. I don't care. I'm going to keep fighting. And we have to have that attitude.
Thank you, Dennis. Yes, would you like to step up to the microphone?
I just have a question. If there was a kind of detox clinic, where would you put it and how would you get the people to actually get there? What does it take to?
We've had this discussion how many times?
If we had a detox, where would we put it? But one problem you have is there are two different types of detox. You have a medical detox, which is extremely expensive. I'm going to tell you right now, it's outrageously expensive to run. And then you have a social detox. For all those who think, oh, heroin detox is the worst, heroin detox, you're miserable, you're sick, you want to think you're going to die right there. Alcohol is so much more dangerous. You cannot compare the two. You can die from alcohol detox. What would you do? It's got to be attached to, somehow it's got to be associated with a medical facility. I really think that that's a need, because anytime you even go into any kind of detox, they say you've got medical clearance, is everything okay? Have you got some medication in case they go into the DTs, and let me tell you, the DTs start quick sometimes. And I've actually had people who have gotten DTs 6 days after they started detoxing. I had a gentleman just recently who he was at mental health and he blew a 3-2-3 on a breathalyzer. You know what it's going to take to get a person like that detoxed? And so your answer is you're going to attach it to some kind of a medical field. You have to have the buy-in from the medical community, because in all honesty, this is also a medical issue that we're dealing with. The impact And just to let you know, the impact on the homeless, on the hospitals and the jails and law enforcement is huge. It is absolutely overwhelming because they spend so much time in, there was a $1 Million Murray, I think it was in San Francisco, where how much time he spent in the hospital there. And there are opportunities to address these things, but it takes stepping out of the norm and taking the big step. Lodi Memorial, I want to say, has stepped up to the plate. They are doing stuff. It's phenomenal what they're doing. I encourage you to talk to Lodi Memorial about the things that they are doing. Another group that's not represented here is the CareLink program, which is through community medical centers, and actually they just opened a brand new clinic in Stockton. But they've been so active here in the community, helping follow up with those people who have medical issues that are homeless, actually coming out on the street and meeting with them and seeing them. And then it's just an absolutely phenomenal program, and they have done absolute wonders and things. And we tag team and try and say, have you seen this person? I might find somebody that has a medical issue and I get them up with them, and they might find somebody who has mental health issues and they call me. And so we work together. All these people, most of these people know my phone number. They know how to call me. We got a wonderful place in between Stockton and Lodi called Wayside. Absolutely phenomenal program right now, and it's helping get people off the street. Absolutely wonderful. There are programs out there. It just takes so much energy and so much work, and you actually have to be dedicated to it.
Well, it seems to me, Dennis, that somebody's going to have to, and I'm looking at Tim for a reason, somebody's going to have to summarize what we've all been talking about for the last hour or two. But it seems to me that then you're saying, Dennis, if I may paraphrase what you're saying, that we really have problems like mental health and substance abuse that require us to look at those problems in a multifaceted way, so that we look at the problem themselves, and the problems themselves are not easy of solution, and therefore we have to involve the medical community and other communities as well, and it becomes almost a universal problem.
Absolutely.
And that homelessness is just a result of this. Is that the way you interpret it?
I think you've done pretty well with it. I think one of the things that Joseph said early on is that the whole thing about housing first is you get somebody into a house, then you got to deal with the stuff that's going on. Again, if they don't have a roof over their head, they can't think about the legal issues, all these other things. They can't even begin to think about their health and taking their medication. My gosh, you know what it's like to deal with a diabetic that's on the street? Take your medication at a certain time to check your blood. They don't do it.
You're looking at a diabetic.
Can you imagine doing it when you're on the street?
No, I can't.
It's hard enough as is.
As it is,
Yeah.